The message that we continue to emphasize now is vaccination. This is our most important tool at this point in the pandemic. What I can tell everybody is that the vaccine is working. It's a very effective vaccine, no matter which one we're talking about. The main goal of the vaccine is to keep people out of the hospital, and if even if they get infected after the vaccine, to make sure that they're having a mild infection, not a severe infection. And we've seen that happening now. More than 99.5% of the hospitalizations recently have been in unvaccinated people. And we're seeing this in teenagers too. So that's where the emphasis should be in terms of how effective this vaccine. The other thing that I also emphasize is, the flip side of this is people start talking about the adverse effects or the complications of the vaccine. We've given more than 200 million doses of the vaccines in the US. And obviously, we haven't seen any significant adverse effects that would make us alarmed that there should be any hesitation about taking this vaccine.
And if you're not old enough to receive the vaccine, your recommendation is to wear a mask.
Correct. And we're hoping that, the age group that would be eligible for the vaccine is going to change by the end of this year. But obviously, until then, and until we have the approval for the younger ages, we need to continue, all of us, not just kids, continue to be vigilant about, the masking, hand washing, and physical distancing if possible.
Now, this is an airborne virus. So when kids pull down their mask when they're playing or when they're eating, what sorts of things should they be mindful of when they do make that decision?
So, obviously we can't keep the mask on 24/7. There are going to be situations where you need to pull down the mask. The important things to do is to make sure that your hands are clean when you're, moving the mask around your face. Do whatever you need to do. If you want to take a sip of water, pull it down, take a sip of water, put it back on, and make sure that it's fitting appropriately. And that means, it's covering both the mouth and the nose. And we want it to be fitting snugly on both sides of the face, especially now with this Delta variant, which seems to be more contagious, where there's more chance it's someone who's exposed to the virus or catching the virus simply because it's a more abundant virus when it's released from the respiratory tract.
Okay, so let's say you have a child in your office and you're trying to encourage them to wear a mask. What do you say to them?
So I usually use examples. So in terms of, look at us all, look how we're, wearing a mask. We work in a hospital. Obviously a lot of the people who are working there are kind of experts and they're used to, those situations. And we should lead by example, basically. That's one of the important things to do because sometimes you're talking to the child, but you also see that at the same time, the parent is not completely, following all the instructions about how they need to be dealing with their masks. So that's another strategy that we also emphasize, not just to the kids, but also to the parents in terms of leading by example.
All right, Dr. Wasim Balan from Phoenix Children's. Thank you.
Thank you very much.